Hello, my name is Pauline and I'm going to be presenting to you about pressure injury prevention. So let's start. So on this experiment that I'm considering, we're going to have some agendas, and our agenda today is about, we're going to have some sections, which is going to be introduction, methods and design, recommendations and limitation, and we're going to have some references. So most of this is going to be under method and design, and you're going to have participants, interventions, data collection, data analysis, ethical considerations, and vulnerability and reliability that we're going to consider in this experiment. So as I introduce my topic, so I have reasons why I decided to do this topic, and the reason, one of the main reason is because I'm going to be evaluating the effectiveness of pressure injury prevention in various healthcare settings. So pressure injuries affect skin and underlying tissues due to pressure, shears, friction, and which is mostly primary in bony premises. So, and the bony premises is the head, the shoulders, the elbows, the back, and the heel, back of the heel, back of the knee, and the heel. So, pressure injuries, it has affected a lot of places, a lot of people. So this one, it has affected the patients in the healthcare field. It has affected the quality of care. It has led to patients extending hospital stays. It has high cost. It has led to high cost of healthcare, and it has led to decreased quality of life because most of these patients are just lying in bed, and that's not good for the patient. So according to statistics, 1 to 3 million people in the United States are affected annually. Especially this affects the elderly people, hospitalized, and the bedbound patients. So that's something it has been looked at. So under my research, I decided to consider the quasi experiment. This is the post design to evaluate the pressure injury prevention program. So I chose this because due to the challenges in random assignments of the patients. On this experiment, I'm gonna be considering, the outcomes before and after the interventions for effectiveness. So, the quasi experiment naturally occurs, events and, because of case studies, single group interventions, experiments within non-equivalent groups, and the time series design. That's why I consider this quasi experiment. So under this quasi experiment, I'm gonna have the patients, number of patients that I'm considering, and the sample size. So when I'm considering this, is because of convenience in sample in the medical surgical units. In this, I'm gonna have patients who are 18 and above, and these patients gonna be having a Braden scale of less than 610. So, and that at least they are admitted 48 hours into the hospital. So the sample size in this experiment is gonna be at least 200 patients to detect meaningful differences in pressure injury incidences. So under interventions, this is the intervention that I'm considering doing. So I'm gonna have multidisciplinary interventions, which is gonna be gonna give me qualitative and quantitative approaches. So it's gonna be include risk assessment. Using that, I'm gonna have Braden scale. Gonna be considering repositioning protocol, pressure redistribution matrices, staff education, regular skin inspections. So we're gonna have additional things that I'm gonna be considering, which is nutrition, hydration, skincare, and support surfaces. So those are the most important things that I'm gonna consider during my experiment. So when I look at these pictures, we have we have some questions. So this one helps with the the prevention of the pressure injury. So we have some questions, between the legs and at the back. You see even the head too. That's why most of the time we sleep on pillows to make sure our head is comfortable. So I'm gonna be considering repositioning every 2 hours, and gonna be checking for the pressure injury areas. So in this, we say, as I said, we have the head, the shoulders, the elbows, the back, and the heel, and sometimes the back of the knee. That one affects pressure injuries or causes pressure injuries. So according to my the data, so I have ways that I'm gonna be collecting my data and the sources, and the data is gonna be analyzed. So my data, so I'm gonna be collecting in 2 points, which is gonna be pre intervention and post intervention. So pre is the pre intervention, that's gonna be the baseline, and the post is gonna be after I've done my interventions, which is gonna be after 6 weeks. So my data is gonna be include pressure injury incidences, patients' demographics, and risk factors. So my sources, my information is gonna come from patient surveys, medical record, staff surveys, pressure injury tracking, and observation. So my data type is gonna be, which is including the qualitative and quantitative. So qualitative is gonna be including interviews and observation, and quantitative is gonna be surveys and experiments. So my data is gonna be analyzed, descriptive statistics, which means which is gonna be include means, frequency, percentage, and inferential statistics, which is gonna be the t-test and ANOVA. So regression analysis for relationship between variables, and we have thematic coding for qualitative data. So on this experiment, I'm considering this timeline. My timeline is gonna be between 6 weeks. That's when the data is gonna be connected. After that, the data is gonna be analyzed, which is gonna be 12 weeks, and manuscript preparation is gonna be after 18 weeks. So the data is gonna be managed. So the data is gonna be kept secure and analyzed using the SPSS software. So that's what I'm gonna be make sure like my information is kept safe. So under ethical consideration, so I know patients' information or patients' data is very important, and it has to be kept safe to ensure privacy. We don't want anybody to get patient's information. If you're not taking care of the patient, you shouldn't be getting the patient's information. So in that case, I'm gonna be considering the IRB approval required before the study. So I'm gonna make sure like I get approval from the IRB. Make sure like my patients have signed their consent form. Privacy and confidentiality will be maintained for participants. So vulnerability and reliability. So panel testing for data tools, inter-rater reliability checks, and data quality reviews will be done. So data will be analyzed by experts, and statistical analysis with calibrated instruments. That one will be done in this experiment. So in some of these recommendations that I'm considering are, I'm going to be implementing standards protocol by ensuring all healthcare staff understand and follow protocols that have been set. So I'm going to provide education and training for healthcare staff by ensuring they understand regular training sessions on prevention, injury prevention, identification, how to identify these wounds, how to classify them, how to manage and treat. So in that case, we're gonna have patient-centered care. So I'm gonna make sure, like, I'm gonna make sure like my patients are evaluated, monitored, continuous monitoring, make sure, like, effectiveness by regular assessing pressure injury incidences and prevalences. So I'm gonna encourage my patient to participate in this experiment by educating the patients, so and the caregivers, on pressure injury risk, prevention strategies, self-care techniques, reporting concerns, and fostering open communication. In this, we're gonna make sure like we have the right data that is gonna help us understand how to prevent pressure injuries in the future. So another thing, we have some limitation that might limit us from getting the right results, and these are because of limited generalizable due to small sample size. Sometimes, information can be biased when self-reported by the staff and patient's questionnaire. So those are some of the limitations that might affect our experiment. And sometimes you have this possible errors and inconsistency from reliance of on medical records, electronic medical records. So those are some of the things we need to consider when you're doing these experiments. So I have some of the reference here, some of the books or sources that I've used on my research. So in that case, we need to make sure like we stop pressure injuries. So this is the study that I'm gonna consider when I'm doing the experiment. Thank you.